Talking about a drug can never be justified if its pharmacokinetic is not discussed. So let's talk about it and get more information about this. Just for your reminder, PK consists of 4 main parameters, which involves absorption, distribution, metabolism, and elimination. So let's get started on them one by one. When ingested orally, acetyl salicylic acid is rapidly absorbed in both the stomach and proximal small intestine. The non-ionized acetyl salicylic acid passes through the stomach lining by passive diffusion. It is poor water soluble. Ideal absorption of salicylate in the stomach occurs in the pH range of 2.15 to 4.10. Intestinal absorption of acetyl salicylic acid occur at a much faster rate. At least half of the ingested dose is hydrolyzed to salicylic acid in the first hour. At least half of the ingested dose is hydrolyzed to salicylic acid in the first hour post-ingestion by esterases found in the gastrointestinal tract. Peak plasma salicylate concentrations occur between 1 to 2 hours post-administration. The recommended dose of aspirin ranges from 50 to 325 mg daily. Talking about its volume of distribution, aspirin is distributed to body tissues shortly after its administration. Entry into brain is slow, but aspirin freely crosses the placenta. The plasma contains high level of salicylate as well as tissues, such as spinal, peritoneal, synovial fluids, saliva, and milk. The kidney, liver, heart, and lungs are also found to be rich in salicylate concentration after dosing. Low concentration of salicylate are usually low, and minimal concentration are found in feces, bile, and sweat. If we talk about plasma protein binding, 80% of the normal therapeutic concentration salicylate, that is the active metabolite of acetyl salicylic acid, binds to the plasma protein, particularly albumin. Albumin is a protein that is found in the liver, while acetyl salicylic acid itself binds negligibly. Acetyl salicylic acid has the ability to bind and acetylate many proteins, hormones, DNA, platelets, and hemoglobin. Moving on, metabolism. Acetyl salicylic acid is hydrolyzed in the plasma to salicylic acid. Plasma concentration of aspirin following administration of extended release form are mostly undetectable, likely 4 to 8 hours after ingestion of a single dose. Salicylic acid was measured at 24 hours following a single dose of extended release acetyl salicylic acid. Salicylate is mainly metabolized in the liver, although other tissues may also be involved in this process. The major metabolite of acetyl salicylic acid are salicylic acid, salicylic acid, ether or phenolic glucuronide, and the ester or acyl glucuronide. A small portion is converted to gentisic acid and other hydroxybenzoic acids. When we talk about aspirin elimination, excretion of salicylates occur mainly through the kidney by the process of glomerular filtration and tubular excretion in the form of free salicylic acid, salicylic acid, and additionally phenolic and acyl glucuronides. Salicylate can be found in the urine soon after the administration. However, the entire dose takes about 48 hours to be eliminated. The rate of salicylate is often variable, ranging from 10 to 85% in the urine. Elimination of salicylic acid mainly depends on urinary pH. Acidic urine generally aids in absorption of salicylate by the renal tubules, while alkaline urine increases excretion. After the administration of a typical 325 mg dose, the elimination of acetyl salicylic acid is found to follow first-order kinetics in a linear fashion. At a high concentration, the elimination half-life increases. For a quick review, first-order elimination kinetics is a constant proportion of a drug that is eliminated per unit time. First-order kinetics is a concentration-dependent process. means higher the concentration, the faster will be the clearance. If we talk about the elimination of half-life, it is the length of the time required for the concentration of an aspirin to decrease to half of its starting dose in the body. When we talk about half-life of aspirin, it is the time taken by a drug's active substance in the body to reduce to its half. The half-life of acetyl salicylic acid in the circulation ranges from 13 to 19 minutes. Blood concentration drops rapidly after complete absorption. The half-life of the salicylate ranges between 3.5 to 4.5 hours. The clearance rate of acetyl salicylic acid is extremely variable depending on several factors. Dosage adjustments may be required in patients with renal impairment. The extended release tablet should not be administered to patients with estimated glomerular filtration rate of less than 10 ml per minute. So what's left to discuss? Side effects, right? So let's move towards it and stay tuned for that.